Good morning, good afternoon, good evening, everybody. And it's very great to have you listening in on our session, which is the second sub-theme. And we're going to be looking at the extent to which the COVID pandemic will affect the achievement of the Sustainable Development Goals. And I'd just like to remind people, if you want to see a rerun of our session, you can visit the PMAC website on www.pmac2022.com, and you just click on the session of your interest. We're also hoping that this session will be interactive. You have a Q&A box on Zoom where you can enter your questions, and the panelists can see those too, and we will come back to everybody's questions. So and please do feel free to ask questions, because that will make our session very interactive. So far, we've had an amazing opening armchair discussion where we had three amazing women, Margaret Chan, Helen Clark, and Michelle Bachelet, who really set the scene for this PMAC theme of the world we want. And then following that, Dennis Carroll has hosted an examination of the megatrends, which include rising inequity, the NCD pandemic, issues of migration and refugees, looking at new economic paradigms, and finally looking at changing geopolitical relations. And of course, those mega themes really set the background to our session today. And I think also in the opening session, and again, you can see this on the website, there was a fantastic video of children thinking about what for them is a perfect day, showing their youthful enthusiasm for their lives and the things that they loved, be it their friend or football. But then they also spoke of their fears and how they thought the future would be. And of course, that's really what we're talking about today. What's the future for those children going to be? Is it going to be sustainable? Is it going to be fair? Is it going to be healthy? And we have an amazing panel. You've seen the introduction to those. I'll just go through our panel again. We have Agnes Binowaho, who's the Vice Chancellor of the beautifully named University of Global Health Equity. We have Abu Bakar Campo, who's the Director of Health Programs with UNICEF, Richard Horton, who's the Editor-in-Chief at The Lancet, and Ron Labonte, who's a professor at the University of Ottawa and looks at issues of global health equity, and also an activist with the People's Health Movement. And my name is Fran Baum, and I work at Adelaide University, and I'm also co-chair of the Global Steering Council of the People's Health Movement. The way we're going to do this panel is we're going to have a round of questions for each of our panelists. If you want to ask questions while they're answering their first question, then please put those in that question and answer box. And then we will have another round of questions afterwards. So you will get to hear from each of the panelists a few times. But I'm going to start with Professor Agnes. And the first thing I'd like to ask you is, from your perspective, and you live and work in Rwanda, what impact has the COVID-19 pandemic had on the chances of African countries meeting the SDGs? What's your assessment of that?
Thank you for the question, and thank you for having me on this great panel. So the COVID pandemic has affected every facet of human development, not only in Africa, but in other continents as well. And a result of this, what we can see in Africa and elsewhere also is because of its economic impact, it is possible that the achievement of SDGs by 2030 may be delayed. There is certainly a high risk of that. Here, I would like to give three areas where we have that risk. The interruption of ordinary health services during the prevention measure countries have set to stop the spread of the pandemic have made children delay receiving their vaccination. And the 2020 UN SDG goals report note that the level of disruption in childhood immunization globally beginning of March 2020 has not been observed since the inception of the expanded program on immunization in 1970. This was also the case in Africa, the majority of African countries, and some other places in the world. So immunization is a critical tool to achieve the health outcome, good health outcome that are in the SDG agenda. And for instance, the sub-target on health-related SDG is to end preventable deaths of newborn and children under 5. So the disruption of immunization activities could delay the achievement of that goal if catch-up vaccination campaigns are not prioritized, and what we have already started to do in Rwanda. For schooling of our children has been significantly interrupted. And as a result, 2020 has been even named the lowest year of schooling, with a lot of children that have dropped out and so many girls who didn't reintegrate school. On a continent where 40% of the youth are the 40% of the youth have less than 18, this poses a really challenges for the sub-target of the SDG 4, which is on education, and to ensure that all girls and boys completed free, equitable, and quality primary secondary education, leading to relevant and effective learning outcome. So on the size of economy, there was a significant loss in the economic sector. The global economy slowed down, and this has affected businesses and is expected to push 150 million people into poverty globally. By 2021, it was already observed. Africa is estimated to have lost GDP between 200 billion and 220 billion during the COVID crisis. And moreover, in a continent where 80% of urban jobs are in the informal sector, the slowdown of economic activity significantly affects those who lack saving and who have to work today to eat tomorrow. And the catch-up is not going to be easy and will be very costly. So one of the SDG is the eradication of extreme poverty by 2030. And this economic crisis really risks to delay the progress that the continent has made so far. This continent and probably another continent as well. Thank you.
Thank you so much for that, Professor Agnes. I think you've really shown the huge impact that has happened in Africa from the pandemic, and that was sort of being built on an existing level of inequities that I'm sure we'll talk about later. So, Abo, the question I'd like to ask you is that through your work at UNICEF, what impacts of the pandemic have you seen on children, and how do you think they're going to affect the SDGs?
Thank you, Fran, and thank you to part of these distinguished panelists. I mean, Professor Agnes already alluded to some of them, but maybe just to highlight, children, although we're not the face of this pandemic, they risk being among its biggest victims. Children of all ages in all countries are affected by the socioeconomic impact, and in some cases, by the mitigation measures that they may inadvertently do more harm than actually good. For example, the initial reactions of closing schools was damaging, not just for education, but also for early childhood, as well as for mental health of children. What was even more concerning was that certain countries lifted shortly after restrictions on bars, offices, businesses, and even some of the religious establishment. But schools still remain closed. And you can see the impact that it can have on the well-being of those children there. When the pandemic started hit, at the beginning of the pandemic, essential public health functions, especially services for women and children, were among the first or the earliest to be disrupted, and some even closed, putting children and their caregiver, especially women, at greater risk for negative health outcomes. with the overall impact on family and their economic conditions. Children, especially in already poor households, had a higher risk, higher rates of malnutrition, absenteeism, and were vulnerable to diseases for which services were getting or still getting increasingly deficient or disrupted. Let's also be reminded that even in the COVID-19 response right now, it's drawing a lot of resources away from existing services just to respond to COVID-19 in some of those countries, which again is affecting, the delivery of services for normal other health activities in those particular facilities. The gains made so far in terms of health-related SDGs, especially in low-income and low and middle-income countries, are either stagnant or we even see reversing trends. The exacerbations of multidimensional poverty, which Professor Agnes alluded to because of economic hardship, parents who have lost their employments, had a profound outcome on children and their well-being, affecting learning in early childhood development, threatening child survival and their health as well, as increasing level of malnutrition, reduction in access to life-saving vaccines, reversing the years of gains in HIV/AIDS prevention and treatment, increased risks of violence, domestic violence in particular, exploitation and abuse, as well as rising level of early and forced child marriages. All these points to an unfolding crisis for children. In summary, COVID-19 is for women and children, is a women and children's rights crisis, often not adequately recognized because the pandemic initially affected the older population. But the way how the trends are going, this may even not be true even in the future. With the inequities in terms of access to vaccines for population in low and low middle income countries, children in these countries are facing hardship that will last longer and have profound effects on child-related outcomes, reversing the many gains that countries were proud of for the last decades. So there's a multifaceted of impacts on this particular COVID-19. We hope that we have seen at least some kind of the end of it, but we are not yet sure because this pandemic has been proving us wrong many, many times. Back to you, Fran.
Yeah, thank you very much. I mean, that's quite a devastating picture. And I think your idea that, yes, this initially was seen as a pandemic that affected old people really just is now proving not to be true. So that's really good points. In terms of the broader picture, I mean, I think we'd all agree that the world is facing two big crises at the moment. One is pandemic, but the other huge, particularly existential crisis is climate change, which is breathing more and more down our necks. And the Lancet, under Richard's leadership, has really spearheaded attention to how climate change is going to affect health in all sorts of ways. And I guess, in what ways do you see those kind of two twin crises affecting the SDGs, Richard?
Well, thanks, Fran. Lovely to see you, lovely to be here. I mean, I could give you 17 answers, couldn't I, for one for each goal, but let me try and be a little bit more focused. Let's start with SDG 3. Let's start with our health goal first. I mean, the fact is that the climate crisis, for that is what it is intensifying its effects on health. We're seeing the frequency, the intensity, the duration of heat extremes increasing. That is having an effect on driving greater mortality and morbidity, greater hospital attendances, greater emergency room visits from heat-related illnesses. It's having an effect on adverse pregnancy outcomes. It's causing more illnesses in very young children who have, of course, immature thermoregulatory systems. In adults, especially over 65 years of age, the cardiovascular stress and strain, the effects on pulmonary disease are all becoming worse because of this greater intensity of heat stress. Heat is affecting over half of the global population, over 1 billion workers worldwide who are working outside predominantly are being affected by this intensification of heat. That's having an economic impact in reductions in productivity, as well as a safety impact. So it's less safe to work in those occupations. There are also interactions with population and aging. If you have a larger population and an older population, then clearly you've got more risk for those people. They are more vulnerable. Add to that increasing rates of urbanization with urban heat islands, and you can see how almost every single direction of travel that our populations worldwide are currently taking is leading to a greater risk. Now, you very kindly mentioned some of the work we've been doing. Every year we publish what's called this countdown on health and climate change. And what we try and do there is to quantify the effects of the climate crisis on health. And just to pull out a few examples from the 2021 report that we published last fall, we're seeing dramatic rises in vulnerability of populations worldwide, especially in low and middle income settings. We're seeing dramatic increases in the exposure of those populations to heat stress. If you just take, for example, the very youngest members of our society, those under 1 year of age who are particularly vulnerable to heat stress, over 600 million more days of vulnerability for that particular group of people. We're seeing mortality increased for the over 65s, over 300,000 deaths in 2020, reported in the countdown last year, and greater threats to food security. So unfortunately, from SDG 3's perspective, we're seeing multiple diverse harms through the climate emergency. Now, if we then expand to the broader SDGs, I'm not going to go through all of them, but I'm going to identify 2 areas that I think are particularly concerning to me, because it's impossible to talk about climate and the SDGs without talking about the intersection with the pandemic. And there are 2 particular intersections that I think we should be especially concerned about. The first is on issues of equity. There is no question that women, those in resource poor settings, older people, the disabled, minorities, those low paid workers who are working on front lines of essential services, migrants, they have borne the brunt of the pandemic. And so we have seen inequality worsen, not only within countries, but between countries. The pandemic has perversely benefited the ultra rich in our societies. If you look at the combined wealth of US billionaires, for example, their wealth has gone up by over $600 billion during the pandemic. And their total wealth, the total wealth of US billionaires, which is over $3.5 trillion, is greater than the wealth of all 54 countries in sub-Saharan Africa. So the world has become more unequal and more unjust because of this intersection between the pandemic and the climate crisis. And that has particularly affected women. Gender inequality has worsened. It is women who have been more likely to be thrown out of their jobs than men during the course of the pandemic. And the second area that I would identify from the SDGs is SDG 16 and 17, because we have seen our institutions challenged and undermined. take WHO as a prime example, and partnerships weakened, even sabotaged by the increased nationalism and populism that we have experienced during the past 2 years. So I don't wish to be gloomy, Fran, and I don't want to be overly negative, but I think that the world is most definitely in a worse place today than it was 2 years ago when this pandemic began. And it's our responsibility to call that out and to think about how we fix it.
Yeah, thanks, Richard. And I mean, those figures that you've quoted on inequity, and I know Oxfam published a really good report highlighting the way in which billionaires have gained so much from the pandemic. I mean, they're actually mind-blowing. It's very hard to take in how unfair that is. And I'm sure we'll be coming back to that. We have had our first question, which is from Liz Mumford, who's asking, are we only discussing SDG 3? But I think already we've shown that we're looking at the intersections in terms of so many of these SDGs. And I hope that will happen. Now, I think if you think Richard was making us a bit depressed, Ron's probably not going to help us very much in that line. And Ron has done a lot of thinking about global health equity and how that intersects with economic systems. And Ron, can you tell us how you think our current economics system threatens the achievement of the SDGs? It's a big question, but you're up to it. So off you go.
Okay, thanks, Fran. And I'm going to be covering some of the same territory that Richard's already mentioned. I mean, in terms of how our present economy threatens achievement of the SDGs, it's really in two ways. First, and this is particularly since the rise of neoliberal economics in the 1980s, and as Richard's pointed out, many others, inequalities in income and wealth have simply skyrocketed. Now, it is true that poverty at this extreme $1.90-day level did decline substantially during this period. And that's largely a result of globalization's corporate outsourcing to low and middle income countries. But this, of course, was also at the expense of the hollowing out of the middle class in many high-income countries and underpinned some of the rather right-wing reorganizing that's happening in many of those nations. So we now have a new SDG target to eliminate extreme poverty by 2030. But this was so far off the mark even before the pandemic hit that it was adjusted to reduce extreme poverty to 7%. And with the pandemic adding another 100 million or so to the current number, this would mean that around 700 million people will wake up still extremely poor on January 1st, 2030. Now, if we were to use the more reasonable ethical poverty line of $7.40 a day, and that's the consumption level estimated to allow people to have an average life expectancy of around 72 or 73 years. Now, if we use that as a poverty line that we wanted to achieve, over 4 billion people will still be poor when they wake up in 2030. Now, as Richard's pointed out, well, most of the world's people saw their income shrink with the pandemic. The pre-pandemic era of financial market liberalization, combined with low interest rates and government pandemic borrowing to create another massive bubble in stock market world of speculation and derivatives. And that's a game only the 1% and really only the 0.01% can play, with billionaires globally seeing their net wealth rise from $8 trillion to over $13 trillion just since the start of the pandemic. Now, it's important to point out that that amount of wealth buys a lot of political power, with corporations and the uber rich lobbying like crazy to prevent any increases in taxation. And that's presumably they're very deeply enjoying the new Gilded Age that 40 years of tax reductions in the name of spurring economic growth has gifted them. And so that's one reason why we're not going to achieve much, at least in terms of the eliminating poverty or reducing inequality SDGs. But the second and more fundamental one, which touches again on points that Richard raised, is that our growth-centered economy is based on an ever-increasing upward spiral of consumption and production. And it's this relentless growth engine that's the key driver behind our climate crisis and the unsustainable fact that humans already consume in environmental resources almost twice the amount annually that the Earth can regenerate. And this growth-centered consumption economy is also incredibly inequitable, not simply in income and wealth terms, but also environmentally. Most of the carbon and pollution emissions and most of the consumption of environmental resources is heavily skewed in favor of the world's wealthier individuals and nations. And the latest Oxfam report estimates that the 20 richest billionaires alone have carbon footprints 8,000 times greater than the combined footprints of the world's poorest billion people. So as with wealth, this growth in equity and consumption by those living in high-income countries and by rich elites worldwide leaves very little consumption space for the poorer half of humanity to improve their life chances, at least not without the rest of the world, and especially the 1% going on a massive diet. Now, such a diet would mean stopping the growth economy engine that we've been living with for decades, and which neoliberalism in the 1980s put on warp speed, and which now places even the environmental SDGs out of reach. So in simple summary, our present economy's pursuit of such growth and wealth accumulation threatens most of the SDGs. And we keep kicking the can for radical measures into another generation's future. And that's not fair. And that's not the world we want or need. We can talk about how we change all that in another few moments. Thanks.
Thanks, Ron. I mean, that data you said on the carbon footprint of the very rich compared to the billion poorest is just mind-blowing. Professor Agnes, I think quite a few people in public health have now heard about the success that Rwanda's had in the last decade or so in moving towards achievement of the SDGs. How do you think that's happened? What areas do you think have been the main areas of success, and how has that been achieved in your country?
So, as Richard and Ron have said, and Abubakar, we are going to have problem like economic problem, like many other countries. However, as continuation of what has happened during the MDGs, where Rwanda was one of the leading countries to reach the MDGs. And during the first years after 2015, we were also on good track to reach them in many areas. If I take, for example, education, SDG 4, related to education and to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all, we have 98% of our girls and boys that are enrolled in primary schools, and 70% of children with disabilities in Rwanda are enrolled in primary school. Of course, in secondary school, the first barrier happened, and especially in science for girls. So we need to improve in that area, and it was ongoing. Like what we do in my university in medical education, we enroll systematically 70% of girls, only 30% of boys, to balance the gender equity in medical education, because we have only 28% of women in as medical doctors across the continent. So we were on track to make progress. In health for SDG 3, also ensure healthy life and promote well-being for all at all age. We had made progress in under 5 mortality, reducing it, now it's 34.3 deaths per 1,000 live births, which is a drop from 221 deaths per 1,000 live births in 1917 and early 2000. So we need to reach 25% per 100 live births by 2030, and we were on track to achieve that. Like now, we have 90% of children below 2 who are vaccinated against all the basic vaccine, and 99% of women that get at last one antenatal visit, and 45% who get the 4. And we have 93% of women who deliver in health facilities. So the maternal mortality also has reduced from 100 to 203 per 1,000 live births between 1992 and 2020. And we need now to reach 70 per 1,000 live births. And we were on track to do that. And I believe we can achieve it. We can still achieve it. Because what we have seen during the COVID, even if the uptake of essential health services has been reduced in many countries, in Rwanda, we have managed, after the first months of lockdown, the country have adjusted and managed to keep the primary health services going, even the vaccination and the delivery in health facilities. So if we look now in gender equality, the SDG 5, we have, Rwanda has been a leader in the field. And we can see that in the political arena, we have 61% currently of women in parliament and 55% of ministers are women. In education, I told you we need to do an effort in secondary education for gender equality, especially in science. And so in human development, we will make it. In economy, I don't know, because the damage of COVID on our economy need to be assessed, and we cannot yet see what it means. When we talk about climate change, with what the COP26 have declared, it's not good for us, because all countries in the world have been developed using energy that we are not going to have access to, or we are going to be penalized. Of course, IMF will give a loan with very little interest, but we know where it's going to be. Africa will not make it and will have more debt than ever. And with this approach to solve the climate change, where Africa in general, and I count my country in, where Africa in general have to pay the excess that the rich world have done without real compensation, we are going to be poor. And the solution that are provided to us is to make us even more poor. So we need to be innovative. We need to do our to start manufacturing what we need, and start stopping buying from outside, and the little money we have going outside. So there is a lot of change we need to do, courageous change, political change, and I hope that the leaders in Africa will have the gut to say no and do the way they have to go for our development.
I think they're great questions you've raised, and especially the point about the climate change and the total inequity of that. One of the questioners has actually asked whether we should reduce the goal for the SDG health goal in light of the pandemic. Would you want to do that? In other words, to make it...
Never.
That would be what I would think, but tell us why that is such a bad idea.
We need to challenge ourselves to do the best. And if we give us little goals, we will achieve little. So we need to look to have big vision, to push ourselves to do the best, because who are going to suffer? They are the poorest among the poor. And Rwanda, we are still poor. We have only $820 per capita. What is little? And we have achieved better than other countries, sister countries, but with a higher GDP. We are almost at 70 years life expectancy now. So we can achieve all those goals. I'm sure we can. So we should not give us the goal to drag Africa down. We need to give us the challenges to be innovative and find new way to achieve and even overcome that.
That's great. Thank you. Abu, moving on to you then, I mean, building on that, what do you think are the most vital measures that will improve the life chances of children, particularly in low-income countries, where, you know, we've heard that it's not just a question of resources, it's a question of what you do with those resources, I think, and that's perhaps an important measure. But what would you see as the key priorities?
Thank you, Fran, and it's an absolute delight to follow Professor Agnes, who has hit some of the key points. I think what is very important is that we cannot let one crisis compound another. The pandemic is threatening decades of progress in reducing child mortality, and essential public services must be protected from the negative impact of COVID-19. So strengthening epidemic and pandemic preparedness, in our opinion, starts first in building a strong, resilient primary healthcare system. Professor Agnes has alluded to it many times. All the intervention which he has mentioned, which has basically helped Rwanda to achieve their results, were built on primary healthcare services quite a lot. This is really essential to respond and to prevent future epidemic or pandemics. And building a more resilient primary healthcare systems will also support countries in their ambitions towards universal health coverage and achieving the health-related SDGs. It is a massive undertaking. And yes, Professor Agnes, you're right, it needs to be a lot of guts, courage, and decision-making from our governments. For all of us, governments, donors, and health-related development agencies, we must put primary healthcare as the priority and invest heavily on building back better primary healthcare systems that can not only withstand any future onslaughts, such as the COVID pandemic, but maybe the next time it will not be COVID-19, it will be something else. But while they're responding to those countries, they need to be able as well, to maintain services, or public health functions to the most vulnerable, in particular children and women, without any interruptions. Towards this objective, we need to look at essential health supplies, including vaccines, the entire human resource for health, including community health workers, and monitor the reach of our services to all communities. And in these new days, using digital health and transformative technology. We know from analysis that communities with high proportion of children with zero-dose immunization are often the worst off and face multiple deprivation. So those communities, as we used to like to call them now, zero-dose communities, they're not just facing health issues, they're also facing illiteracy. So there's an education problem in those communities. Water and sanitation is also lacking in those communities. These are also those communities which have the highest rates of malnutrition, and poverty, as we have been alluding to it many times, is probably rampant in those communities as well. So we need to make those zero-dose communities our priorities in every single country, in every single district or provinces. We need to reach those communities because as our services, different services, not just health, can be reaching those communities, I think we will be getting one step closer to the SDGs. Primary healthcare also for us means investment or more investment in risk communication and community engagement. It's not just about facility service, it's really reaching out to the community, building this trust between community and the service providers as well the human resource for health. I think these are the key principles, key fundamentals in primary healthcare implementation. And UNICEF is committed towards giving the priority attention to primary healthcare in low and middle income countries, as well in low income countries. Yeah. But it's not just about health, I think, in terms of responding. I think for that, we need to really think, as Professor Agnes has mentioned, looking at the gender equality. But even in that sense, we think that primary healthcare is a very good proponent for women empowerment to a certain extent. In many countries, the larger effect or the larger proportion of human resources are actually women. if we can get them on payroll, like community health workers, we are giving them a financial incentive to be much more a bigger voice in decision-making process in their community as well. So it's not just about health when we talk about primary healthcare. Water and sanitation is a key element of primary healthcare, and it needs to be improved of every single community to contribute in terms of not just saving lives, but also making sure that the well-being of those children is respected. And we cannot talk about moving towards the SDGs and innovating. I think Professor Agnes mentioned this as well. We need to be innovative. We need to be creative, of trying to figure out ways with the limited resources which are available to be much more efficient. So governance of our programs does play an important role. How do we bring in digital health or digital technology, to help us monitor our programs, to do telemedicine to a certain extent where it is possible in that sense. All of this, what I have mentioned, that also means that we need to work across sectors to mitigate against various barriers which are faced by women, girls, children, and marginalized communities. Resuming safe schooling. I think education for us is an extremely important activity which needs to be resumed as quickly as possible, because the consequences of children not going to school are by far greater than the impact of just COVID-19 strictly on children in itself. So we look at the response as multi-sectorial. It needs to be a whole society approach. It cannot just be one single sector addressing the issues, so that we mitigate, the long-term consequences of some of our actions which we are taking. And our first credo should always be, do not do harm. And this is what we need to be looking at in terms of really responding and making sure that we can preserve lives, but not just preserving it, also helping children not just to survive, but also to thrive.
Well, thank you. That was a fantastic answer. And I think you went some way, both yours and Professor Agnes's went quite a way to answering the question that was about how do we get intersectoral, multi-sectoral approaches that work. I might come back to you later and ask you about some examples of where you've seen that intersectoral work going well, or if you have some examples, but we'll perhaps come back to that on the next round. Richard, over to you. I think Professor Agnes has already pointed out some of the disappointments of COP26, particularly from a low-income country perspective, particularly from an African perspective, and the way in which it made all these, forgets about history of who's used the most carbon in the past and who's benefited from that use of carbon. But given it was disappointing, can you see any hope? Because some of the pessimistic predictions for the climate, can you offer any hope in any way?
Yeah, there's a lot of pessimism around, Fran, isn't there? I've been joining a few calls this week, which the Council on Foreign Relations in the United States has been organizing, thinking about America's role in global health. And the universal message from many American friends is also very, very gloomy, that, in a very fiercely divided Congress, American retrenchment post-Afghanistan, thinking about Trump coming back in 2024, people are pretty depressed in the US, and also not really seeing many reasons for optimism. But one of the lessons that I think we've learned at the Lancet over the last 10 or 15 years in relation to climate change actually is that you've got to motivate change by being optimistic. And if you try and bludgeon people into thinking that apocalypse is around the corner, then that does not motivate people. What apocalypse does is it paralyzes people, because people think they've got nothing to contribute if it's so certain that we've got no future. So I do want to remain optimistic. It's right, I think, that post COP26, it's right that we're disappointed, but it would be wrong to think that Armageddon is before us. Incremental progress is being made. Actions are being taken, slower than we would like, we all agree. But I think to say that it's just blah, 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 to coin a famous phrase from COP26, I'm not sure that that's necessarily the right response, because there is a convergence of opportunities here. So I'm going to give you just one example of where I am very hopeful. So this year is the 20th anniversary of the Global Fund to fight AIDS, TB, and malaria. And the 7th replenishment for the Global Fund is taking place in the second half of this year. It's being hosted by the United States. Now, there is an intense discussion that's taking place right now, at this very moment, about what should the Global Fund be in the future. Should it continue to put AIDS, TB, and malaria at the center of its focus? Or should it begin to broaden its remit, recognizing that there are these other issues that need to be addressed? The climate crisis, pandemic preparedness, antimicrobial resistance, a whole panoply of issues which, when they interact with the existing threats of diseases such as AIDS, TB, and malaria, actually are synergistically a lot worse than they would be on their own. So the opportunity is that we take the most successful global health financing instrument of our generation, and we think about how we reinvent it for the future. Now, I know that Peter Sands is very open to rethinking the role of the Global Fund. I know that in their draft investment case, they are thinking very actively about how to rewrite the mission of the Global Fund. And I think the challenge for us in the global health community now is to get behind that re-envisioning, that renaissance of the Global Fund, and to persuade donors that investing in the fund will be a worthwhile thing to do to protect us for the future. Because clearly there is a pressure on money. Donors are not going to want to invest massively in new instruments. As we've heard already, countries have been so damaged economically by the pandemic. But it's our job to give confidence to politicians and decision makers to invest in a revivified global fund. So that's my hope. Converging threats, successful existing institutions, a moment to reinvest, and our job is strong advocacy to make it happen.
Yeah, well, thanks for that, Rich. I mean, some of the criticism of the Global Fund in the past has been that it's being driven by the donor countries rather than being driven by countries like Rwanda and other countries in Africa. Do you think that, because doesn't that need to change, that kind of mindset as well as the topics?
Fully agree. And the discussion that's taking place is a different governance model.
Okay.
So, I mean, if one's going to reinvent the Global Fund to take on a broader set of issues, then the existing governance model doesn't work. You have to give more power to countries. So then what is the right governance model for that? And that's an area that active discussion, but absolutely business as usual can't continue.
Yeah, okay. Agnes, do you have anything to come in on that to say, or are you happy to leave it?
I totally agree that there is a movement, notably linked to the decolonizing global health, etc., that is positive. But it's not enough for the after COVID period, because even if we have a better access to money for a better multi-sectorial use of the money to make it more effective in the human development, we need also economic opportunities that go with that. If I look to my continent, where the majority are young people, that if we don't, for example, manage to boost the economy and create economic employment, the continent is going to be so unstable that what we improve in the health sector will not be enough for our overall development. So we need to change the Global Fund. We need to change the World Bank. We need to change the IMF. We need to change so many mechanisms of funding. And also we need to change other things like tax evasion. If we have all our taxes in our continent, staying in our continent, my goodness, yes, we will make it. Yeah. So there is a lot of things to do.
Yeah, and I think that's a great lead into what I'm going to ask Ron about. And also one of our audience has asked, Ken Bishop has asked Ron, saying that the solutions to change capitalism, he says it's naive, but without a profound change to wealth imbalances, other things aren't going to work. He took that as what you were saying. But do you think, Ron, that capitalism can be transformed in a way that it will assist achievement of the SDGs? And are there other economic systems that might do that more effectively? Again, a big question, but let's start that, and other people may have some views on that.
So I get the easy ones. I'm really not sure about how to answer at least the first part of that question. So let me try to explain. I think that to begin with, we can reject the idea that a growth-oriented, profit-accumulating economic system will somehow magically transform and become socially just and environmentally sustainable if we all just became stakeholders in capitalism. Now that's the model that's put forward by the World Economic Forum, which at least is critical of the short-term shareholder capitalism of the past half century. But under the cloak of corporate social responsibility, this model really risks increasing the role of already powerful capitalist stakeholders taking over what remains of democratic governance. Now, we do have some more ambitious government-centered plans that have been put forward in the wake of the pandemic. So the promise is to build back better, which is the slogan of the US Biden administration's $3.5 trillion 10-year plan. However, since scaled back thanks to Donald Trump's long shadow and the power of the fossil fuel industry. The EU's multi-trillion next generation recovery fund and European Green Deal similarly promise a green recovery, emphasizing a new circular economy in which there's no longer anything like waste, simply a continuous recirculation of post-consumer materials. Now, so far, so good, if such plans aren't held hostage by right-wing recalcitrants or fiscal hawks, beating the inflation drum and keen to see the pandemic spending of governments reined in with new austerity measures, which of course would be a tragic mistake. Now, another option on the table is being advocated by Mariana Mazzucato in her recent book, Mission Economy, where she argues that government should lead in mobilizing public and private partners to achieve important economic, social, and environmental goal-oriented missions. Now, Mazzucato chairs the World Health Organization's recently established Council on the Economics of Health for All, and their first mission policy brief outlined a different approach to health innovation than the flawed government responses to COVID-19 vaccines that led to pharmaceutical profiteering and gross inequities in vaccine access. Rather than responding to market failures, the WHO Council argues that governments should use regulation and tax policies to shape markets toward democratically decided upon social and environmental outcomes, which of course could incorporate many of the SDGs. And that's a very neo-Keynesian idea. Now, one way to do so is for governments to put stringent conditions on companies that benefit from public spending and infrastructure. And in the case of vaccines, such conditions could have required technology transfer by vaccine companies whose research and manufacture was largely financed by public funds. Now, Mazzucato is also a fan of modern monetary theory, or MMT, as are many heterodox and even some mainstream economists. And in simple terms, what this means is that governments with their own sovereign currency can never effectively run out of money. They simply issue bonds to be held by their central banks. Now, there are concerns. One is that most developing countries lack a sovereign reserve currency and so have to borrow on the private market, making them vulnerable to financial volatility. And we're already in the midst of another global debt crisis. So you can't just rely on this particular strategy in the absence of agreements internationally around income or wealth transfers or redistribution. And now another is that the $13 trillion in MMT-inspired quantitative easing that high-income countries used to keep their economies and people somewhat afloat during the pandemic, unfortunately, it eventually wound up in the hands of speculative investors. And that's one of the reasons we're now confronting inflation. So strong regulation of financial markets, targeted taxation to reduce inflation and speculative investing, and measures to restrain monopoly profiteering are all seen as companion policies to an MMT-based Build Back Better. Now, if we're able to go in that direction, we're still left with capitalism's requirement of endless growth and rising levels of consumption, however green or recirculated that consumption might become. And so terms such as degrowth or post-growth have slowly entered policy discourse, and they call for a democratically led downscaling of material-based production and consumption worldwide. Now, many in poorer nations will still need more, while those in wealthier nations can make do with considerably less, with little or no sacrifice and more likely improvements in the quality of their life, their happiness, and even their health. Now, such an equitable reduction in consumption by humanity's wealthiest decile is also essential to create much needed space for growth in countries where livelihoods need to rise if people are to sustain good health and achieve reasonable life expectancies. And these are some of the points that both Abu and Agnes have made in their presentations. So this mission economy arguments that Mazzucato and others provide, I think that they can be viewed as a radical reform base from which we might imagine and then enact a new vision for governments to become much more interested in promoting the well-being of their citizens and planetary ecosystems than in the metrics of GDP growth. If countries start to band together to do this, it could lead to economic transformation so dramatic that we might no longer refer to them as capitalism. Now, I'm not sure what we might call it, though the French economist Thomas Piketty likes to describe it as participatory socialism. Now, whatever name it acquires, it cannot be the capitalism of the past. And in moving towards it, we also have to work to protect the space for social movement activism, to challenge governments to begin these essential mission works for equitable human well-being on an environmentally healthy planet. Because that is the world we want and which the SDGs imperfectly point us towards. But if we don't really push in that direction, unfortunately, we could find ourselves on a perilous slope towards increasing autocracy. And that could be very life-threatening for many of us. So hopefully we're going to be pushing more in that direction of big mission economies, kind of a vision of a post-capitalism economic system.
Thanks for that, Ron. That's taking us into some of the sort of economic theory and ideas behind them. I wonder, the basic dilemma that I think the questioner asked and you've pointed to is that, the so-called rich world, which, is rich in some measures, probably not in others, is going to have to give up some of its consumption. And people in low and middle income countries, quite rightly, still expect that their living standards should become closer to those of people in rich countries. And yet we all know that a lot of the kind of right-wing populism comes from populations who actually are suffering as a result of a rollback of their economies. How do you think that can be managed? Because that's a difficult, when we hear Agnes talk about Africa, there's some really real demands there, and they're just prima facie social justice. But I'm not sure that that's how people in high-income countries are going to necessarily see it. Do you have any thoughts on that?
I would go with some of the environmental economists on this argument, which is that one thing we need to do is we need to remember that in the 1960s, we were in high-income countries, we were consuming at a fraction of what our consumptogenic practices are today. And you grew up in the 60s, I grew up in the 60s, Richard, you grew up in the 60s. I don't know, I'm not going to presume about Abu or Agnes, but for many of us during that period of time, things were fine. That we had a pretty good life, quality of life. We do not need the kind of consumption levels we have to be happy, healthy, or to enjoy each other and to have a sense of purpose in our lives. So I think that we need to pressure governments to basically start to sort of say, we need to descale, we need to decrease our levels of consumption in high income countries. We need to sort of set some targets, something like a circular economy. If we can push forward on that, it takes us part of the way, not the whole way. And I think that most people in high income countries would support that, because they don't want to see their environments destroyed. We have all kinds of tax measures that could be introduced. I mean, we had 40 years where we saw our corporate and income taxation and marginal rates drop precipitously, and now we're wondering why we've got so many wealthy people. Well, taxation is still an incredible tool. If countries would stop competing with each other to grab that surplus floating around capital in the world by getting into their tax competition with each other, and actually agreed on some global levels of taxation beyond just the 15% of corporate taxation that now they've at least talking about agreeing to. So we can go and look at a financial capital transaction tax. There are measures in taxation, in improving labor rights, but ultimately, we need to reduce the level of consumptions in wealthy countries and by wealthy individuals if we're going to create the ecological resource space for many in kind of the developing world, in the low and middle income countries, to actually grow into that ethical life expectancy. I mean, I don't see any other way in which we can do that. So we just have to get really angry and call on our governments to actually step up. To
do that, yeah. Okay, Abu or Agnes, do you have any comments on that from your perspective on this issue of consumption and how this plays out in low income countries?
We are not going to go down except if economically we are obliged. We really want to continue our journey to development. And so if we are obliged, we are not going to do that happily. So especially because we absolutely know that if it's an artificial situation, Africa is not a poor continent. However, all the wealth is going elsewhere. And this is really, this continent, people are stealing. And the complacency, it's so huge that I have problem to have the optimism of Ron on even in the rich country, the civil society, to convince the government, because they know what they do. They are not blind. It's by purpose. So, and also in this continent, many head of states are complacent with this system because they gain personally with the complacency of the high income country leadership that help them to stay in power. And when you have the gut to stand up and go against, look at your back and order your coffin.
Yeah, so that shows that this is an issue of power and people exerting power in their own interests. Yeah. Okay, Abu, I think you've taken your mic off. Did you want to contribute on this issue?
Yes, I think Professor Agnes said it beautifully. But if I can maybe just come in, we talked a little bit at the beginning about iniquities, and I think the world has become, where the rich are becoming richer and the poor are becoming poorer. And in high income countries, where your amount of people living under the poverty line is quite very low, it might be manageable to a certain extent. You still have a very strong middle class. But on the African continent, that's not the case. You're pushing poor people who are living under the poverty line already into situations where they become angry. And many of our security issues today, if you're looking across the continent of Sub-Saharan Africa, it's not so much thing, it's not a country fighting against another countries. It is internal conflict because of this rise in inequities between the different groups, where people with their back at the wall, saying enough is enough, and resolving to actions which might not necessarily applaudable, but that's their last resort. I mean, we all know the saying, you know, a hungry man is an angry man. Yeah. And unfortunately, we have a lot of angry men, in particular young people, who do not have the opportunities, who can't do anything. And I think that's where we believe that more investments into the social sectors and employment creations should be basically done on the African continent. And that needs, you know, good governance from many of the African countries, you know, and really making very courageous decisions, you know, to favor their population so that we can bridge the gap between those who have and those who have not. And I do want to believe that one of the biggest way of giving back to the communities is the health sector, is the education sector, is the water and sanitation sectors, because if you can put those things back into the community, at least, you know, many of those communities will be grateful. Villagers, they don't ask for much. Yeah. If you go into those villages, they don't ask really for much. But even these little things which they're asking for them to be given, it's not given to them. And yet, at the same time, they're seeing others from the same countries, you know, having a different behaviors, and yet there shouldn't be so much different in this particular sense. So I think if you don't, if in whatever systems we are building, whether it's a capitalist systems or social systems, if you don't take into account, you know, the social dividend or contribution to economic growth, we will be keep treating, you know, those ministries which are so-called identified as social ministries as the beggars of the government, and investing in areas where we should be investing a little bit more, because the health sector is not a poor sector. And in fact, we actually think that the health sector contributes to economic growth, but it's never demonstrated in one or the other ways. There are a lot of private sectors who are benefiting from the health sectors, but they are not counted as contributory to the economic growth of those countries. So there needs to be a change of narrative of what is the contribution of social sectors to us, so that adequate investments are basically done, and that we look at those sectors a little bit differently as we have done in the past.
Yeah, so you see them as building people up. But it strikes me that, Abe, with your comments about primary healthcare and the comments you've made now, if you think back to the original Alma Ata Declaration, it actually talked about a new economic order needed to underpin primary healthcare, and just the way, and of course it talked a lot about intersectoral. So, you know, I think it was all laid out there in the 1970s, and it's good to hear us getting back there. But I think we sort of started talking about processes. And Richard, I think on one of your comments, you said you were worried about the goal 16, which is peace, justice and strengthening institutions, and the partnerships one. I think you said, you know, you've got concern about those. Do you want to say a little bit more about that? Because I think it builds on some of these issues we've been talking about.
Sure, thanks, Fran. Well, I think when the pandemic began, what we would have wanted ideally would have been some kind of global coordinated response. And what we actually saw was 194 countries pursuing 194 separate strategies, with Tedros doing his very best to act as the conductor and voice. But in truth, at least through 2020, being systematically attacked and undermined and sabotaged by President Trump. And WHO came out of that process a lot weaker than when it went in. And the ongoing discussion about the origins of SARS-CoV-2, which has plagued WHO, and the whole of the scientific community actually continues to erode that multilateral institution. So I think what we've come to right now is a place where there's been a pretty catastrophic loss of trust in multilateral institutions. The rise of populist governments, and unfortunately a breaking apart. I mean, we had Brexit before the pandemic, but a fragmentation of alliances, and in a sense, a kind of what we're seeing, a fragmentation of alliances and now a reordering of those alliances. I mean, you're speaking, Fran, from Australia, and my country and your country have entered into a rather frightening, I mean, I love you in Australia, but I'm not very happy about the fact that we've entered into some bizarre partnership to somehow take on China militarily, which seems to me a completely disastrous foreign policy objective. So at this moment where you have fragmentation of multilateralism, military objectives seeming to be more dominant, and a collapse of a sense of opportunity that the Millennium Development Goals and the Sustainable Development Goals gave us. I mean, there's been a lot of critique of the MDGs and the SDGs, but my goodness, at least they both represented a moment where the world came together to have a common vision of what it wanted. We are not in that place now. We are a long way from that. And trust has been destroyed during the past 2 years. So now I don't want to be, again, there's an opportunity here. And if you give me 1 minute just to say what that is. Never before, I mean, you and I and others, we have complained for decades that we never get listened to. You know, the health people, we're weak, we're not given the time, politicians don't pay attention to us, we've got all the evidence, but we completely fail to get through. Not now, not now. You can't turn on the radio or the television without seeing a health person speaking about this pandemic. We have never had a better platform to speak to the world than we have today. So this conference at PMAC is called The World We Want. Well, we now have the best platform in a generation to say what kind of world we want. So let's stop complaining about everybody else. It's up to us now. It's up to us to formulate our ideas, bring the evidence together, and to tell our leaders what kind of world we actually want. So let's organize, let's do it, because I tell you, Fran, we're not going to have a better opportunity in our lifetimes. So, and we've got a time limited window to do this. I would say we've got at maximum the rest of this year to get our act together, because by the time we go in the Northern Hemisphere into winter 2023, we're going to have an endemic virus and the world will move on to the next problem. But we've got this opportunity this year to state our case. So stop complaining, marshal our arguments, and do it.
Yeah, thanks for that, Richard. And on that theme of, who we have partnerships with, how we do it, PMAC sponsored the People's Health Movement to make a video about the SDGs. And Agnes, you were part of that. And I remember in that you spoke very powerfully about the need to listen to people in the village. There's a top down, we need to get the messages up, but this was like the bottom up. And you talked about how people in villages' voices need to be heard. Could you say a little bit more about that?
I think that COVID have taught us something, is that solutions are global, but will not succeed if there is no local participation. If people doesn't trust, doesn't implement the prevention, also inside the country and globally. I saw, for example, take my country, where a so big number of Rwandans make their living with the informal sector. And when you have a lockdown, this big portion of the population have no savings to eat during a month or 2 months or no, and they have to work today to eat in the coming days. So we absolutely saw a movement of solidarity, saying that if we are locked down and if we want the country to pass through together to stop the spread of the virus, we need to support the poor. The poor will not die starving for the people who can afford to survive. So this has brought solidarity, but locally as well. It starts up also by many people giving 1 month of salary to create a funds to help the poor. But also we have a structure with head of village. Each head of village has to list the people who cannot eat every day. And these funds has helped, and after that the budget came in, etc. But without the head of the village, without a trusted way to identify those in need, it was not possible. So that's why I say the voice of the local voice have to be listened to, but not only for solution locally, but also for the solution we applied nationally. When a woman who is about to deliver and there is no transportation possible, how are we going to make her transport possible? Because when there is a lockdown, ambulances are not enough. So create a system that is linked with the national authorization, security authorization, and local solution to help the people. So now we can bring that globally as well. We need to listen to poor countries, the solution they need to pass through the future crisis and also the recovery of the current crisis, because you will see maybe, Ron, I'm sure you know that where we are now was expected 3 years ago, 5 years ago. COVID has accelerated it. So, but COVID has scared the world. And as Richard said, now more than ever, there is a window to open and to respond to the needs of different countries. But those needs has to listen. We need to listen to the need of people in the countries as well.
Yeah, okay. Well, thank you. I think that's a really powerful point. And I'll go back to Richard here to answer the question in the Q&A. Jeremy Lim says, in reference to your comment, what should be done differently? More talking heads, more appeals to empathy and social justice are unlikely to elicit a different response. So a little bit perhaps of skepticism about, talking heads. What should we be doing?
Well, I'm not sure I agree with that. I mean, okay. What have we seen in the past 2 years? We've actually seen the rebirth of the state. And we've seen often right-wing, quite populist governments recognize that the state has an absolutely foundational role in protecting the most vulnerable populations and protecting the economy, the state protecting the economy, that the market does not solve every economic and social problem that faces us. So that has been an immense discovery for even conservative politicians. Now, that combined with the platform that we have, I don't think it's just talking heads. What it is, it's those people who represent. I mean, we in the health sector, we're not just speaking for ourselves, we are representing the vulnerable in our communities who've suffered most from this pandemic. We're representing women, the poor, migrants, the marginalized, frontline workers, etc. We speak for them because we have a platform. So in our whether you are living in a democracy or a more authoritarian under a more authoritarian regime, we have a voice to guide those who guide the state. So and we have done for 2 years, we've built up that reputation to use evidence to protect our societies. Now let's pivot and use evidence that we've had in our back pockets for decades to build societies not better, but fairer, as Michael Marmot so rightly says.
Yeah, build back fairer.
Can I add something?
Go ahead.
That is absolutely crucial. And that's why also we need to remain optimistic, but eye-open and worry well. But because we had a situation like this after the Second World War, where there was this movement, of course, there was still colony, etc., but this movement of that bring Alma-Ata. But after that, this was cut by neoliberalism and purposely. So now we have this opportunity, little window, and the lesson of the past. We are better equipped to succeed.
That's a good point, I think. We're now coming to the end of the panel, and I'm just going to ask each of the panelists in turn, and I'll start with Ron, as I think he's the last one to talk. But I think we've really had evidence that there's a lot of pessimism of the intellect, but the cliche of optimism of the will. I'd just like you all to say, what keeps you personally hopeful and a bit optimistic? Just spend, you've got a couple of minutes each just to tell our audience, how do you do that? How do you not sink under the weight of the issues that we're facing? Ron?
Well, because it's just a whole lot more fun, more pleasant, more enjoyable in life to be romantically optimistic, even if intellectually pessimistic. The good old Antonio Gramsci concept. But I think that there are several points to be made. One of them, as in Agnes's kind of emphasis on kind of like the village sort of level. My experience has always been, I think most of us probably have had this experience, that at the local level, at the level at which we interact with each other in real time, real space, embodied, most people are really nice to each other. They really do care for each other. The real break comes in terms of how we've organized our political economies so that we've allowed this massive capture of wealth by a small number of people over the last 40 years. That system kind of has to be completely trashed. Now, in terms of other models besides just the kind of the more northern defined kind of degrowth or post-growth kind of models, if you look to increasingly to indigenous communities in terms of how they've tried to manage kind of like environmental resources on which they kind of depend for their own livelihoods. You look at the Buen Vivir kind of movements or some of the peasant activist movements, especially in Latin America. And in terms of opportunities, because I agree that we have maybe just this last year to put forward some alternative visions. I think one of the places that we can do that, apart from multiple places, is that let's sort of see what kinds of statements really need to go into pandemic treaty negotiations. How far reaching are we going to do that? Or are we just going to sort of have a little kind of siloed thing that everybody can agree to that accomplishes next to little? So how ambitious and bold are we going to be in our treaty negotiations?
And that keeps you hopeful, the potential for that. Abu, would you like to go next? And then Richard, and then we're finished with Agnes, if that's...
Thanks, Fan. I think for me, I work for UNICEF. We work for children, so there's no room for pessimism. I mean, if we need to look forward. I think we have become what we are today because our predecessors have believed that things can change, and they have changed the world to a certain extent. And I also do believe that on the planet, we have good example where we do have universal health coverage. Mm-hmm. Where we have good examples where, I mean, things are working, you know. It might not be our example of choice for political reasons, but they do exist. So as Nelson Mandela has said, it always seems impossible until it's done. And I think we're human beings. We should be able to overcome some of those challenges if we work together and really push the agenda, for the common goods for everyone and not just of personal interest. I think it will take time, but somebody has to do it. And I think we are committed to do it. And that's really the one thing which drives not just me, but everyone who works for UNICEF.
Yeah. Thanks. That's a lovely statement. Richard.
Thanks, Fran. Well, two things keep me optimistic. One is my 21-year-old daughter. Because the world we want is not the world for me, it's the world for the next generation. That's very motivating, I must say. And to see her passion and her anger and her commitment, that's a whole generation of young people today. Yeah. That's the future. We're the past. And secondly, though, the people I work with, the likes of you, Fran, and others, because it's that human passion, the interactions we have. Our world is the world it is because of human beings and the choices we make. So we can make a difference. We can change the trajectory that we're on through the work that we do, and the ideas that we stand for, that we work for, the evidence that we try and bring to bear on those arguments. I believe in that passionately. It's old-fashioned to believe in an enlightenment, but I do believe in it. I do believe that knowledge can change the future. And I guess that's what you'd expect the editor of a medical journal to say.
I would hope so. I think we'd be a bit worried if that wasn't the case. Agnes, finally.
Oh, me, I'm absolutely optimistic for many reasons, and I will give you 5 quickly. I just saw that many countries miss the COVID response because of lack of trust. And this has been identified, and we know how to build trust. And I'm optimistic because in my country, 25 years ago, trust was 0. And now we have a country where the population trusts at the best trust for the health sector is in this country. So the world can rebuild trust. Also, we have the lack of solidarity and the inequities that has been exposed so widely inside country and across country, and we know how to solve it. Also, in Rwanda, in my country, we have managed to control the spread of the disease with less than 1,500 deaths. And it's not only our data, because people question our data, it's international data, but also 50% of my people are vaccinated fully. And this is more than 70% of those above 18. We have managed to do that. We are still poor. We have given good vaccine, not expired, quality. So if we can do that with $800 per capita, 820, the world can do that. And we have the recipe. And the last thing, schools are open. My university never closed even one day. And the young people we are educated are so bright, so talented, so dedicated. And across the world, this type of education based on global health equity is taking, seeds are growing, and we will have an army of global health fighters to change the world.
That's fantastic. And I must say, the thing that always makes me feel hopeful is when I spend time engaging with such passionate people. So thanks to all 4 of you. It's been just a delight to talk with you and listen to your passion and excitement for what can be achieved. And thanks, of course, to PMAC for giving us the platform. And good night, and thank you, everybody.